Hey guys, it's Dr. Michael Lee again. I come to you with another dose, this time in video format, of a dermpath lesson. My goal with this channel is to provide educational material that can actually be quite difficult to learn by yourself, but I want to make it as easy as possible and enjoyable to learn this material because it's just fun and I'm extremely passionate about it. So this is called a Desmoplastic Tricholemmoma. So a Desmoplastic Tricholemmoma, that's a huge and obviously very confusing name. And you wonder why people can't remember these things. But let's break it down. Desmoplasia, okay, the first part of that phrase, is essentially just a growth of fibrous tissue. The fibrous tissue, what we're seeing here is this kind of pink stuff in between these bluer islands and cords. So desmoplasia, again, is fibrous tissue, and it's usually a result of local injury. Tumors can do it, as in this case. So tricho, the first half of the word trichilemmoma, is just something related to the hair follicle. And finally, oma is a sort of a suffix that denotes a benign tumor. So desmoplastic tricolemmoma. So now the way you can identify these things is, well, why don't we start first for the demographics? Typically, these occur in older men, and it's typically on the head and neck area. There are other sites, but by far, I believe the head and neck are the most common sites. So the keys to this diagnosis are, you can see this is somewhat of a dome-shaped kind of verrucoid papule. It is very hyperkeratotic here. And you can see that, it's this nice curved round thing. And you can imagine, the dermatologist or physician that biopsies this lesion is, certainly very concerned because we have a keratotic papule and it feels rock firm. That's because you have this desmoplastic fibrotic stroma. So the whole reason why this is an important lesion to identify and to know really is because of this. This area in here is very different than, the majority of tricholemmomas. The reason it's different is because it looks very, very scary. A word that we use is called infiltrative, which implies, tumor cells that are kind of cutting through the dermal collagen fibers. And, when we see that, we usually think like it's aggressive squamous cell or morphic basal or just something, a lot worse than what this is. This is a benign tumor. So let's take a closer look now. So when I come to this area, this kind of pink fibrous, sort of bands. How do I do this? These pink fibrous bands, that's your desmoplasia. And you have these like cords of epithelial cells that sort of seem to be cutting through this tumor. But when you look around on this lesion, you're really not seeing any kind of real atypia. There may be a single mitotic figure here and there, but it's not obvious, right? So let me take this back again. And out here, so the tricho portion of that name, it comes from this area actually. So you can see here's the little hair follicle, and you have this adnexal structure that's extending downwards. If you notice here, you do notice some cells that are a little more pale than you would typically expect in a tumor like this. The cells are pale because this tumor is derived from cells of the outer root sheath of the hair follicle, which is usually you'll have some pale kind of cells there. Another clue to the diagnosis here is if you look at the lateral rim here, you can see that this basement membrane here almost looks like what you would see in a basal cell carcinoma with this peripheral palisading. Let me see if I can. There has to be an easier. Oh man. You come to higher power and you have sort of a peripheral palisading. Again, if you look at scanner through this tumor, you're not going to see really any areas of significant mitotic figures or large scary cells. They're pretty uniform and sort of monomorphic. Let's look at the bottom section here. And this bottom section does one great thing. It really helps demonstrate the follicular origin of this tumor. So here you can see that this here is a hair follicle. Here's like a keratin plug within a hair follicle, and you have this tumor which is emanating from that hair follicle with these pale cells. So that's it. This is a desmoplastic tricolemmoma. One more thing to mention. Oftentimes you can get this inflammatory cell infiltrate. It's usually some lymphocytes in here. We got a couple of plasma cells. Let's see, and that's about it. From low power verrucoid to dome-shaped papule, and you got this firm kind of infiltrative cords within a area of desmoplasia. Thanks, guys. If you guys like what I'm doing here, and if it's helping you, please remember to like and subscribe and share it with other people. Perhaps it'll help them too. Thanks very much.